All right, guys, in this video, I'm going to be covering Ativan or Lorazepam and answer some of the more common questions that I get as a pharmacist. So let's hop right into it. So first of all, Lorazepam is a benzodiazepine, which means it blocks certain receptors. Particularly, it has an effect on GABA, which is a neurotransmitter. It's an excitability neurotransmitter. It essentially inhibits that or lowers it, so you have this relaxing effect. So you see it used a lot in anxiety. Another common question is Ativan a narcotic? It's not a narcotic, it's not a painkiller, so it's not considered part of the narcotic class. What about using Ativan? How does it compare to Xanax? So you're going to have your benzodiazepines broken down into basically how long they last in the body. Xanax is very short acting, so you have to dose it more frequently. Ativan would be considered intermediate. It lasts, we'll get into how long it lasts, but it's an intermediate one. So generally speaking, you see more abuse with Xanax because it's shorter acting. Ativan, not so much. And like the best one probably in the class is diazepam. It's much more longer acting. Okay, as far as side effects, obviously because of the way lorazepam acts in the body, it calms people down. Sometimes it can calm them down too much. They get drowsiness and sedation. Roughly 10% of people. And then in 4% we have asthenia. Asthenia is basically lack of energy, weakness, that sort of thing, and roughly 4%. Okay. Any warnings, any people that need to be really careful with it, one of which is it can actually cause amnesia in some people. So not that you can't take it or shouldn't take it, but it is something to be aware of. How about things to avoid when you're taking Lorazepam? Well, first of all, you want to avoid alcohol. I know obviously alcohol can have the same effects. It can compound the actions of Lorazepam. So you want to be very careful. People with sleep apnea want to be careful because we can have sort of that, not only the drowsiness part of it, but we worry about breathing issues. Somebody who's sleeping. Acute narrow angle glaucoma is actually a contraindication. You cannot use it if you have that. And I bring up myasthenia gravis because it's not a contraindication in the United States, but with the Canadian labeling, it is a contraindication. So I think it's important for you to know that, you and your doctor, if you have myasthenia gravis. How fast does it work? We kind of touched on this earlier, but again, Lorazepam is intermediate acting. If you take it by mouth, you're going to start noticing the effects in 20 to 30 minutes. Your blood levels are going to peak in around 2 hours and then start dropping off after that. Okay. How long is it going to stay in your system? The half-life of Ativan is 12 hours, which means that when you have blood levels, they'll drop 50%. So 50% of the drug will be out of your system within 12 hours. More or less, we tell people that you can probably see Ativan last up to 8 hours. It kind of depends on the person. And finally, people ask a lot, can I get withdrawal? Taking Ativan, the answer is a resounding yes, you can. So you have to be very careful. If you and your doctor decide that it's time to go off it, you are going to have to go off it slowly. It puts you at a higher risk for withdrawal symptoms if you've used Ativan or Lorazepam for a long time, if you have higher doses that you're using. And as I mentioned earlier, the shorter the half-life of a drug, the higher the risk of withdrawal symptoms. So for example, Xanax, very short acting, very a shorter half-life, that's higher risk. Ativan is in the middle as far as risk of withdrawal with the benzos, and then something like diazepam that lasts longer has less risk. But the point is, any of the benzodiazepines, Lorazepam included, there is a risk of withdrawal symptoms. So you have to go very slow if you and your doctor decide to go off it. So let me know in the comments, have you used Lorazepam? Any problems? Was it effective? Let me know in the comments. It's helpful for me and it's helpful for other people that watch the video. So I appreciate it, guys, and I will see you in the next one. Thank you.